My name is Carrie Van Zee.
My name is Ken Van Zee.
We're from Cedar Rapids, Iowa. We have 3 kids. Our daughter is 2.5 and her name is Vivian.
But we adopted our daughter Vivian. She was born in China and we brought her back from China in June. We were informed about the adoption that she had a congenital heart defect, and so we knew coming in that she was going to need a surgery. We didn't know everything that she was going to need, but so we got back to Cedar Rapids in June, went to see a pediatric cardiologist there. And he recommended that the next step that needed to happen was a heart catheterization. Recommended coming down here to the University of Iowa to do that.
This is a very new journey for us.
Once a patient is identified to need a cardiac cath, the following occurs. Your referring physician will ask to have a procedure scheduled in the pediatric cath lab at the University of Iowa. Our cath lab staff will ask for referring records and tests as needed from your local doctor. At this time, it will be decided if general anesthesia or conscious sedation is needed. Conscious sedation is medicine we give to keep you comfortable. You will be called by a pediatric cardiology representative to discuss potential dates and times of the procedure. Once the procedure is scheduled, you will get an informational packet in the mail if the procedure is scheduled far enough in advance. This packet includes procedural instructions as well as hospital information, lodging information, and maps.
Most of the time they will be able to get an informational letter in the mail if the procedure is maybe 10 days or 2 weeks away. Sometimes if there's a short time frame, all this information is relayed on the telephone. They do get in the mail a map on how to get to us, instructions on where to find the Peds Specialty Clinic and Peds Cardiology. We also go over directions for what they can eat, what they can drink before the procedure. Sometimes we have to give special instructions as medication. And we also give them instructions on what to expect and what should they bring to the hospital. Try to answer questions as best as we can to think of things that they might not think of to ask.
You'll have a pre-cath visit either the day before the procedure or a few hours prior to the procedure. During this visit, we will discuss your current state of health, medications, allergies, and the procedure itself. You will have blood work done during this visit. You may also need to have other testing done, such as EKG, echo, or chest x-ray. Procedure consent will be obtained at this time as well. Patients and families are encouraged to bring their questions to this appointment.
Typically what I do is I come meet the family during the pre-screen visit and I talk about the way that the catheterization is anticipated to go. We talk about the risks and the benefits and obtain the consent. And then we do a careful physical examination to make sure there aren't any surprises before we start the procedure. I think when you come for the pre-screen visit, it's important to know just kind of the general health of your child before you get there and making sure that they don't have any recent colds or infections. Knowing the medicines that your child takes when you come is always helpful for us, so we can help assist in planning on whether you should take those the morning of or not.
The next day, they undergo additional paperwork just to get their names in the computer and to have an actual visit scheduled, followed by the anesthesiologist, the one who's actually going to do the procedure. And if I have not seen them the day before, I see them on that day to make sure the parents' questions are answered. If it's an older person, the patient's questions are answered.
Before the procedure began, things weren't rushed. We met all the doctors and the nurses that were going to be involved in doing the procedure. They explained what part they were going to be playing and exactly what they were going to be doing. So it wasn't just like, okay, bring her in here, we're gonna go take her to the room now, bye.
What I love about being here is that you're with your child till the very end. You know, we were able to help him get into his gown. We were there when they gave him his medicine that put him to sleep. And then you walked him in.
Actually, you carried him.
I carried him into the cath lab and was able to stay with him until he fell asleep. So we felt like we were, you know, there during the scary times for him until we couldn't be there
until they had to
anymore.
start the procedure.
On most occasions, we will let the family come in with their child until their child falls asleep. That probably is the most trying moment of the procedure for the parents, because now you're leaving, nothing is in your hands anymore, but that's what we're here for. We're here to take care of your child.
I'm confident that when their child is in our care, that everyone in the room is doing everything they can to take care of them the way they would their own child.
On the day of the procedure, there's several of us that are in the Peds Cath Lab with them. One person is more of a monitoring, charting kind of person, and another nurse would be more at their bedside doing things you might think of more from a nursing standpoint?
We work to distract them while they're going under the anesthesia. We do whatever we can to make them relax.
I've been awake during cath procedures as well as asleep. I think that someone that's older and can understand a little bit more would be fine with being awake, and they keep you comfortable, and it's definitely not frightening or anything.
The x-ray equipment that we have, first thing you'll kind of notice is the big C-arm as you come into the room. That's our equipment that will actually be taking the x-rays and be able to see the pictures of the heart. Kind of think of it as a big game room. You know, you got all your different little monitors. One you could be playing your Wii on, one you could be doing your PS2, the other one you're watching TV. So basically, we don't get all those fun little things in the room, but it's that same kind of technology.
A small flexible tube will be placed in the crease of your leg. Other sites may be used, such as the neck or arm. This depends on your cardiac anatomy.
Once the patient is anesthetized or sedated, we will move plastic tubes under an X-ray machine called fluoroscopy in order to look at the various chambers, obtain some blood samples to measure the oxygen numbers and then the pressures in those chambers. And depending on what we find, either we are there purely to obtain information for surgical planning, or sometimes we're there to actually do a procedure. I usually will tell the family how long they should expect the procedure to last. We give them a pager to carry so we can text them with messages saying catheters are placed, we are now proceeding with the next steps, there are no problems, or that we need to talk to you, and that doesn't mean there's a problem. We just need to tell you something that was not discussed before. That shouldn't be a scary event. That pager is just to communicate.
One thing that helped the situation was that communication was there at all times.
They give you the little pager and they're really good about checking in with you and letting you know that he's doing really good, come back in about such and such, or letting you know what's going on so you're just not out there in the dark. You get a little more comfortable as time goes on. You go downstairs and maybe grab a bite or something like that, because you know that they're going to contact you.
We're sitting here talking to you while Vivian is in the middle of a heart catheter procedure right now, and we just sit here in complete confidence that it's going well and they're taking care of her, and they have a way to communicate with us and tell us how things are going right in the middle.
Things are going well, thanks, Brenda. All right.
Yeah, I mean, for such a little device, that's such a big deal for parents, I think.
Don't be afraid to ask questions. I would always come up and I'd write my questions down, and some of them might have been repetitive, some of them might have been simple questions, but it's okay for you to question, and it's okay for you to know exactly what's going on. If you can't find somebody to answer that question, see if they can find
There's somebody else
that can.
Following the procedure, if you have had general anesthesia, you will go to the recovery room for approximately 60 minutes. If you have had conscious sedation, you will stay in the pediatric cath lab recovery area for 30 to 60 minutes. Generally, pediatric patients will go to the pediatric cardiology inpatient unit. You will be placed on bed rest for approximately 6 hours, and your diet will be slowly advanced as tolerated following your procedure. Adult patients will go to an adult floor that will be determined on the day of the procedure.
You're going to wake up to my face and the anesthesiologist, and I will follow you through the hospital for most of the day to make sure that you end up comfortable. We make sure that the right orders get placed for you to get the right medications and other follow-up.
Once the procedure is done, we then talk to the family and go over the findings, what we have done, whether there were any problems or not, and where they will go from there.
Most of the parents' concerns lie in the recovery process. When will my child have any discomfort following the procedure? When will they be able to resume normal activities? So in general, we have them, we instruct them to ramp up their activities over the next week. They can typically attend school in a day or two following their procedure.
The recovery process after you're out of the hospital is very fast. You feel no pain the day after, anything like that. It's just getting through that long period of time laying flat and watching, and distracting yourself by watching TV, eating popsicles or whatever.
Your length of stay following your procedure will be determined by how you recover and the actual procedure that is done. All patients and families should be prepared to stay overnight following your procedure.
Being 5, it's hard to stay entertained all the time, but Child Life did a wonderful job coming to our rooms and playing with Jack.
A child life specialist here at the University of Iowa Children's Hospital helps children and families cope with hospitalization. We provide medical preparation and medical play for children to help them learn about their illness and learn about different procedures that they might have. There's nothing normal about coming to the hospital and having a procedure, so we just try to make them feel more comfortable overall.
You frequently hear is that your care doesn't stop after the catheterization. Your care continues after that.
You will be contacted by a pediatric catheterization lab staff nurse following your procedure to discuss how you are recovering and to follow up on any unanswered questions.
It's nice for these families to know that they have access to staff here, that they can get their questions answered. Even though we are a large facility, that we're very readily available for them.
Obviously, you don't want your child to have to go through any kind of scary medical procedure, but when you are put in that position, I just would say that I can't think of a better experience that we could have than what we have had.
It's a first-class operation.
It's probably the best, I mean, in all seriousness, the best medical experience I've had ever.
Believe in miracles, because there was a day when times were tough and we didn't know if we'd ever make it through, and just believe that miracles do happen.